if you'd like to introduce yourself a bit, that would be really excellent.
So my name is Hong Ji-am. I'm a researcher working at Wesley Institute. We are a Toronto-based research and policy think tank that works to promote health and health equity in Toronto and in Ontario. And I have a passion in the issues, improving the experiences of immigrant seniors in accessing publicly funded services. And so I have been leading some research projects related to home care and long-term care for immigrant seniors.
Okay, and cut.
Cutting.
So my name is Catherine Doherty. I've been in the field of caring for seniors for a little over 20 years now. In that time, I've had many different jobs within the same home, and I've enjoyed all of them. They've all been very different.
Do you think that, in general, the type of work that personal support workers do is well paid?
No. No. Yes. Right. No.
People access home care services when they need personal support and nursing support to able to support them age in place. So they don't need to, they're not at the stage of going into institutionalized care such as long-term care or retirement homes, but they have some, their independency, their autonomy, their health supports them to be home, but they need some kind of support such as a nurse's visit to provide medication, to change their bandage or give some injections, and oftentimes it's mainly personal support workers work. So home care providers who come in can provide bathing, and they can help with daily chores, and then they can help them maintain their health and well-being.
I don't think that we're compensated financially. I don't think we're respected as much as we should be. Clearly, the pandemic showed that the nursing field, the healthcare field, steps up when we need to, but I don't think that we're in a respected role the way we could be.
This report, we wanted to look at how different groups of seniors are accessing publicly funded home care services. And then we wanted to look at how immigration status, how racialization and clients' language could have an impact on their use of home care. And we found that immigrant seniors and those from racialized communities and those whose mother tongue was not English were more likely to report that they did not receive government services, but they were more likely to receive informal services, informal care from their family members mainly. And they were in comparison, they were more likely to report they had unmet needs for home care.
It's a very demanding job, and not only is it a very demanding job, but it's a very demanding job 365 days a year, morning, noon, and night. So it's not something you don't get to turn it off. You don't get to just say, "Oh, I'm done for the day if the next person doesn't come into your shift. These are human beings and vulnerable human beings that need assistance.
Some communities whose mother tongue is not English had specific challenges in terms of getting access to care in their language. So when they call the public unit to ask about home care, they were often discouraged because there was no person who could speak their language. So and when they get to talk to someone in their language, they often get discouraged because they realize that there are not services available by staff who speak the same language.
You find that it's mostly women who do the job of care work, or the PSW, the personal support worker job?
Yes. Healthcare field, it's a female-dominated career for the most part. We do have male doctors and male nurses and male PSWs, but not to the extent that we have female.
At this point, with their dementia, declining cognitive health, they lose their English proficiency, and then they go back to their mother tongue, so they cannot fully communicate in English anymore. So that just pose a risk for them in terms of how they can communicate with personal support workers when there is a care, and even difficult for them to gain access to care.
There's very few residents that I could say I didn't have some kind of relationship with, especially, as I said, if I'm doing cares for them. You're interacting with them for 8 hours a day, every day. So it's really hard not to become part of their world and know what their kids are doing and their grandkids are doing and that kind of stuff.
So the support they are missing out will be like the basic stuff, which is so critical to maintain your health and well-being, and also your family's well-being as well. So support such as bathing, cooking, eating proper meal, and doing groceries, and also and community support such as socialization, without proper public support for transportation. For example, if you are the one with mobility issues, having difficulties with public transportation, many people talked about loneliness and from being isolated from the community, because many people left alone at home while their other children and their grandchildren go to work or go to school. There's no one at home they can interact with, they can get support from. We have this expectation that South Asian families and many other racialized immigrant families, they prefer living together, and then it's a norm. The intergenerational family living is a norm, like a value that they respect. But it's also true. But at the same time, what we heard from our focus group was that it's not a preferred option, but they are forced to live with their other children because of their financial dependency on their children.
So do you think the low pay is related to care work being undervalued?
Yes,